afternoon, everyone. Bonjour à tous. Thank you for joining us. Merci d'être parmi nous aujourd'hui. My name is Kina Leclerc and I will be your moderator. Je m'appelle Kina Leclerc et je serai l'animatrice de ce point de presse. Before we begin, I'd like to go over a few items. A reminder to place your phone on mute until I invite you to speak or to ask your question. And please do not place the call on hold. Available for questions from the media, we have, disponible pour répondre aux questions des médias, nous accueillons Mayor le maire Jim Watson, phoning in au téléphone, Councillor Keith Egli, Chair, Ottawa Board of Health, conseiller municipal et président du Conseil de santé d'Ottawa, Steve Kanellakos, City Manager, directeur municipal, la docteure Vera Etches, Chief Medical Officer of Health, médecin-chef en santé publique, Anthony DiMonte, General Manager of Emergency and Protective Services, Directeur général des services de protection et d'urgence. Phoning in au téléphone, we have Stephen Willis, General Manager, Planning, Infrastructure and Economic Development, Directeur général de la planification, de l'infrastructure et du développement économique. Dan Chénier, General Manager, Recreation, Cultural and Facility Services, Directeur général des loisirs, de la culture et des installations. Sheila Doherty, Program Manager, High Economic Impact Projects, Planning, Infrastructure and Economic Development, gestionnaire de programme, projet à forte retombée économique. We also have on the phone Alain Miguelez, Manager, Policy Planning, gestionnaire, planification des politiques, and Clara Friere, Lead Human Needs Task Force, responsable, groupe du travail sur les besoins humains. I will now invite each agency alphabetically to ask their question. You may ask one question with one follow-up. Par ordre alphabétique, j'invite maintenant chaque organisme à poser une question et une question de suivi. We will now start with 1310 News, Deborah Reeder. Do we have 1310 News on the line? Okay. Moving on, we will go to CBC, Joanne Chianello.
Hello, good evening. Almost good evening, I guess, everybody. That's a long meeting. I would like to ask, I guess, about the mayor and also to Steve Willis, a little bit about part of the meeting today that talked about what happens with employment lands, what happens if somehow there's a big shift towards people working from home. I thought that was a pretty interesting motion, Mayor, that you and Councillor Egli moved. You know, we're in the middle of the coronavirus pandemic here, and everyone's wondering how this will change our lives. The Shopify's announcement earlier this month really shook a lot of people. And so I'm wondering if you could talk a little bit about, you know, your concerns or what you're thinking about for the future when it comes to growth and perhaps the way we are changing the way we live.
I'll start and then ask Steve Willis to offer some supplementary comments. I give good credit to Councillor Egli for bringing that forward, and he asked me to second it, which I was happy to do. I think you know, COVID-19 has turned the world upside down, as we know, and unfortunately we don't have a clear roadmap as to where this is going to take us. And so I think the prudent thing for us to do, and what Councillor Egli was hoping to accomplish, is that we need to look at the concept that Shopify just announced that I think took a lot of people by surprise, but we're also seeing with the federal government more and more people working from home. And you know, there's pluses and minuses to that. I'm not as pessimistic in terms of we're going to see all this the downtown emptying out. I still think there's a positive reason why people want to meet, get together, you know, socialize, have meetings. I can tell you, I'm sick and tired of conference calls and Zoom chats. I'd like to be able to be in a meeting where I see people and interact with them. And I think while Shopify has made that decision, they're going to review it in a year's time. And I think we have to be in step with the reality of post-COVID-19, how we are going to plan our downtowns and our employment lands in the future. Steve?
Thanks, Mr. Mayor. You know, a lot of experts and pundits are writing about the future of urban planning after COVID-19, and I think it's. I'm not going to be one of those people that tries to predict the future. I think this motion is prudent, and Councillor Egli and I had a vigorous debate on this. My perspective on this is that we've had previous significant recessions in Ottawa, major federal layoffs, where we've had a period of time where there was a hollowing out of office space in the downtown, but over time with population growth, that space was filled again with different users. Some of it was converted to other uses, some of it was just new businesses. Lately, we've seen a lot of tech companies moving downtown that never looked at it before, and they're taking over space the federal government formerly occupied. And I think over 25 years, with 400,000 more people coming to the city, we should see an economic activity that would reabsorb it. But I did concede that with Councillor Eglai's point on this, because I agree with him, is that if we saw a major shift in trends, our plan should enable conversion of buildings and office parks wherever they may be to new uses, and that should be something we should enable in our policy right away. And if it so turns out that we're having such a big structural shift, it may allow us to meter out our land needs a little bit more slowly over time.
Yeah, Joanne, it's Keith. I just wanted to say, I just wanted to make sure that we didn't miss out on an opportunity. I certainly share some of the mayor's feelings that people are getting a little worn out with phone calls and Zoom and Skype and everything else. But if it is the way it's going to turn, and I just wanted to make sure the city was ready and to take advantage of that opportunity and to repurpose, those lands into housing.
Okay, thanks. That was really interesting, and I thought that was a really interesting part of the conversation. And I get we don't know where we're going yet, but speaking of where we're going, we're also trying to help the entertainment industry, and restaurant industry, with margins so small already, if they have to social distance and only have like half of their own, half of their usual clientele, is expanding the patios going to be enough for them? I'm wondering if someone can just talk, or a number of people can talk to that. To that plan, when the restaurants will be able to open, do you think? And what areas of the city do you think that we are going to see these restaurants, these patios expanded, as well as given a little bit of accessibility around them as well?
I'll offer a comment because it was my motion, and then perhaps Dr. Etches and Steve can talk about some of the logistics. This is a small help. We think it's a significant way that we, with limited resources, can help the restaurant industry. We don't know what the rules are going to be at the end of the day. I suspect it's probably going to be, you're going to have, as you pointed out, Joanne, probably half the capacity indoors. So if we can supplement that with the other half outdoors, safely positioned or spaced apart, then that's something we can do. And we have obviously our economic task force is looking at other things that we can do to help the business community. As you know, we've deferred the property taxes by a number of months to give them some cash flow challenge. They're having cash flow challenges. But you're right. The restaurant industry, is it's a very tight margin, and you see, restaurants coming and going fairly frequently. And obviously, I think we're going to lose some of our restaurants, some of the long-standing ones even, because they've been out of business and out of revenue for literally 10 weeks now. So we have to be respectful of the health considerations. And Dr. Etches, maybe you can talk about those discussions at the provincial level as well.
Yes, so I'm not an expert in running the industry. What we're trying to help people understand is what is higher risk, what is lower risk right now as we go back to more activities, and certainly indoor activities where you're in close contact with somebody for a longer period of time would be on the higher risk end of the spectrum. And so things that we can do to decrease that risk include moving people outdoors, keeping people further apart. So the patio solution does help with that.
And Steve, on the issue of the types of streets, I gave two examples, Joanne, the Ministry of Coffee and the works on Wellington or in Richmond Road, just at Churchill. Those are the kinds, I think, streets that we're looking at. Steve?
Those are near you, Mayor. I feel there's a conflict there.
Yes, no, I've sat on those two patios. That's for sure. Yeah, Steve.
Yeah. Mr. Mr. Mayor, just in response to that, we have a lot of streets where we have on-street parking that's not being used because of the level of economic activity going on there. In the past, we've tried pilot projects for us using those spaces. Now we have a chance to take a pilot project and really put it to good use and do much more of it. Several businesses have, like you go down the Bank Street corridor, they have parking lots to the side of their buildings that they might be able to use. There are, and certainly we're trying to deal with some of the zoning issues even on commercial plazas and the like as well. So we're looking for every opportunity to make it as easy as possible for them to do that, and it's our job to try to help in this very difficult time.
How about the restaurants at Lansdowne?
We understand they're working on a scheme, and I look forward to getting more information on that. I don't have that information at the moment, but I do know they're looking into it.
Well, actually, most of the ones at Lansdowne actually have a patio. I'm thinking of Local and Joey and the Sunrise Cafe. They all have outdoor seating as it is. So, they may be able to expand those because obviously there's room at Lansdowne for expansion next to those properties.
Thank you very much.
Thank you. Moving on, we will go to Josh Pringle at CTV Ottawa.
Thank you very much. My question is for Dr. Etches. In the dashboard that came out today, it shows testing numbers, which looks to be around 200 to 300 tests for COVID-19 a day in Ottawa. Are you disappointed that the numbers seem so low? And is there a reason why the numbers are so low? And is there a way that you can increase testing beyond saying anyone who wants a test can show up and get tested?
Yes, those numbers don't tell the whole story. There are some notes attached to the dashboard that explain those numbers are taken from the Ontario Laboratory Information System, and not all of the laboratories report to that information system. There's some other reasons different testing numbers that are completed in Ottawa wouldn't be reported there. So we have been working with our partners to try to come up with new ways to capture data about all of the testing that is happening in Ottawa, because it's more than 250 tests a day. The capacity for the whole region, so that's east to the Quebec border, west to Renfrew. The labs that we have in Ottawa can test about 1,900, perform 1,900 swabs through the system each day, and we have at times exceeded that capacity across the region. My understanding is that we're reaching that again right now with the testing opened up to anybody who wants to present for testing. So, what Ottawa Public Health is doing is bringing to the conversation about the testing strategy, information about who's at highest risk, where do we need to be testing the most, how do we prioritize, and we're working with our healthcare system partners who are working very hard right now to be able to manage the increased flow at the assessment centers. They're prioritizing if they need to. They're making sure people who are vulnerable, children, aren't waiting in line in the heat. But this is a change in direction that is currently putting stress on the numbers. And the dashboard is really, it's not perfect information right now. We're continuing to work on it, but we wanted to indicate that that is a dimension that's worth monitoring. So we do want to share and improve and be transparent about the volume of testing and the comparison to the capacity for testing that's happening in our community.
Do you have a follow-up, Josh?
Oh, sorry, I was on mute. Mr. Manconi said today that transit ridership the last 2 weeks has started to increase. I know there's going to be a presentation on Monday to the Transit Commission, but is OC Transpo, or does OC Transpo have buses available to increase capacity on some busy routes if there are busy buses right now?
I can answer that, Josh. Yes, the short answer is yes. We've already made some adjustments a few weeks ago because we had feedback from riders that the buses, I think there were a couple coming in from the West End and some from the East End that were overcrowded. So we did add extra buses. As you know, we're running on a Saturday schedule, so we have the capacity to add additional buses when it gets busier. And on Monday, John Manconi at the behest of Alan Hubly, the Chair of Transit, will be bringing forward their recovery plan on what they plan to do, post and pre-COVID-19.
Thank you. Moving on, we will go to Craig Lord at Global.
Hi, this would be a question for Mayor Watson. We're seeing Ottawa's COVID numbers. They appear to be getting more under control, heading in the right direction, but other parts of the province, it's not necessarily following that trend. So I'm wondering if you've spoken with the Premier lately about adopting a more regional approach to reopening so Ottawa isn't maybe tied to whatever happens in Toronto, for example.
I haven't spoken to anyone in the province about that. I'm having a phone call later this week with John Tory because he's bringing up the same issue with respect to the GTA, and Dr. Etches has raised that issue as well with me. So I wanted to get a sense from him how it's going with the other mayors of the GTA and whether he's had any discussions, and then from there I'll follow up with the province. Dr. Etches, did you have any comments on the regional approach? Because it's a challenge for us all, because on the one hand, we don't want to have a situation where, it's a patchwork approach and then people start going into an area that seems to have a low number of COVID-19. But at the same time, should we be judged on the same level as Northern Ontario, where there's, it's a world of difference in many respects in terms of a big city versus smaller municipalities? Doctor?
So I can say that as a member of the group of medical officers of health in the province, we are all following the provincial framework, and we support the provincial framework, that there's 4 dimensions to monitor. No surprise, those are the 4 dimensions that are on our dashboard. So we're looking at the state of virus, spread and containment, about the healthcare system capacity, the public health system capacity, and our testing and tracking capacity. And so what we're doing then is looking at the same things across the province, but the picture may emerge differently. So the findings based on the information that we're collecting in these different categories or dimensions of the response may show, for instance, in the GTA, that there is more of a pressure of ongoing transmission, and that may require local actions that are different from place to place.
Great, and just to follow up, I think for Dr. Etches or maybe for Keith Legway, Councillor King had put forward the idea earlier in the day about opening up a new testing centre in the east end of Ottawa, but I'm not sure where the discussion ended up on that. Is that something OPH is going to look at?
So Ottawa Public Health is working with our healthcare system partners, the Champlain Health Region Incident Command, to take an overall look at the testing strategy. There's kind of 3 types of testing that we're doing right now, if you'll give me a moment to explain. We're testing when there's a case. We're looking at the contacts and making sure that we can identify the contacts around a case and stop ongoing transmission. We're testing when there's outbreaks. So the same thing, if we find one case, then we go and we look at the whole floor or the whole building or the whole institution or workplace if needed. And that kind of testing is a top priority for public health control. The other kind of testing that's happening is in congregate care settings. So that's long-term care homes, retirement homes, shelters, group homes. That is continuing, and we're looking with the province about what that frequency should be, what the best approach is to continue that testing. We're taking a risk-based approach so that those homes in the worst situations or have the most challenge are going to be tested more frequently. The last kind of testing that's happening is that testing of the broader public, and specifically the new aspect is of asymptomatic people. And so we're going to learn from that. We're going to see what's happening in the people that are coming forward. What are we finding? We're going to continue to look at the geography of the cases and the exposures that people have. And that will all inform whether we need more testing in different locations, I'm doubtful that we would go and invest in a large assessment center again. I think we're more interested in innovative models that allow us to move the testing capacity around to where it's needed. But certainly we've heard the request from the East, and that will be part of what we're looking at and in the whole analysis of where things are needed.
Great, thanks so much.
Thank you. Nous allons maintenant passer à Julien.
Now move on to Julien Paquet from Le Droit newspaper. Hello, everyone. My question is for the mayor. I'm curious to know what you thought about what the Integrity Commission had to say today about the adventures he's gone through, or the hoops he's had to go through over the past few months to try and get a simple answer from Mr. Shirelli as to whether he'll be participating in the investigation or not. What did you think about that? What was your impression of it? Well, it's a situation which is a bit strange. It's clear that Mr. Shirelli has no intention of answering Mr. Marlowe's questions. I'm disappointed by that position, but it's his choice. And now Mr. Marlowe must table a report to the Municipal Council without actually Mr. Shirelli's side of things. I think it's a mistake. I think it's a mistake for Mr. Shirelli not to talk to Mr. Marlowe, but at the end of the day, really, it's his choice not to cooperate with Mr. Marlowe. My follow-up question is for Dr. Etches. Now, the mayor gave us figures at the start of the council meeting today on the number of municipal bylaws interventions. There have been warnings and fines meted out to those who have failed to respect the rules. I think it's encouraging to see, really, that at this first stage of the lifting of the lockdown, that people have continued to obey the rules. What's your opinion on that? I didn't hear the figures about the number of people who have been warned or fined for not following the social distancing rule, but there is a team, my team in fact, that's doing polling currently. To find out what percentage of the population is in fact following the guidelines. It's important for us to fully understand how people are actually following the guidelines, because it's really physical distancing which is the best able to prevent infection. Testing, assessment centers, that only comes into play once someone gets infected, but what's most important is to prevent infection in the first place, I think. So we'll be sharing this information with you once we have the results of the poll or the survey. But it looks like most people in Ottawa are doing their bit, they're doing their share, because the number of infections in our community is going down. It's very impressive. And I appreciate that people are continuing to follow the rules. Thank you very much.
Avais-tu une autre question?
Did you have another question, Julien? Well, I can, but I've already asked 2 questions. Sorry, Julien. Thanks for your 2 questions.
Sue sharing on the city from the burbs. Moving on to John Willing, Ottawa Citizen.
Hi, everyone. I'm just wondering what the uptake was like today for the cooling centers, and what is the city's plan for, I guess, late spring and the summer for more cooling centers or cooling-related activities to help out residents?
Thank you, John. As you know, we opened the 4 cooling centers yesterday. By the end of the day, there was only 3 uptakes. Today, the cooling centers only received 11 people. I think it's a little early to tell. We've got those 4 up and running. We're also analyzing the uptake and to see if there's any other areas of the city that we should have cooling centers available as you mentioned, as the summer goes on. So it'll be something that we'll continue to monitor with our staff and with the councillors in each of the wards who are also feeding us information, what they're hearing from the public. So it's still to be, it's an evolving situation, but we want to ensure that we have those facilities available.
Thanks, Tony. By follow-up, different question. It has to do with the municipal public service, and I'm wondering if Steve Kanalakis or Tony, maybe you, I don't know who, but is there an indication when the municipal public service will begin returning back to offices at City Hall or Constellation? Are you looking in months, or are we talking about, you think, in 2021?
Thanks, John. No, we're presenting that information on June 10th to Council, but I can say at this time that we don't anticipate any public servants who are home right now. We'll be opening up some services, so they'll be coming back, but most of our administrative buildings will not be occupied for the summer, is where we're sitting right now, and it could be longer. We're still finalizing that assessment over the next 4 or 5 days, and we'll be briefing the mayor and briefing council.
Thank you both.
Thank you very much. Moving on to Taylor Blewett at Ottawa Sun.
Hi, I think it's Liz Payne at the Ottawa Sun. It's a question for Dr. Etches. I'm just looking for her comment on the military report on long-term care, and I wonder whether any of those findings is reflected in long-term care homes locally where public health and other health workers have been.
Thank you for your question. I have read the military report, and it is very disturbing. Obviously, it's not the standard of care that everyone deserves. So I appreciate that the Premier is going to do more of a review, and I really support that. Locally, we know that some homes have struggled more than others to be able to have the staffing levels that they need. And it's been a while now, a number of weeks, that hospitals have been paired up with the homes with the most challenge, and that is why we have not had to call in the military to Ottawa, and the homes are benefiting from the added support of the hospitals.
And I mean, some of what they described in that report, have there been any similar findings from people from the outside, healthcare workers who have gone into homes in Ottawa?
That's not something that has been reported to me that I'm aware of.
Okay, all right. Can I just ask you whether there's further homes that are going to get these deep investigations by the province? Do you know if any of them are local homes?
I don't have any information that any Ottawa homes are the ones that are on a list for priority investigation. We do keep in touch with the long-term care home regulators who are responsible for practices in long-term care homes if there is a challenge.
Thank you.
Okay, thanks.
Nous allons maintenant aller à Stéphane Leclerc.
Stéphane Leclerc from Radio-Canada. Stéphane, are you there? You're not there? Okay.
Go to
Alors, on passe maintenant à Patrick Negocioni à Your Community Voice. Ma première question pour le Dr. Etches. Je voulais plus de précision sur les chiffres qui ont été publiés sur les quartiers. Quelques conseillers ont demandé plus de dépistage dans l'est de la ville et d'après les statistiques, il y avait un certain nombre de cas par 100 000 habitants. Vous dites que ces données ont été rendues publiques aux fins de transparence, mais est-ce que les gens qui vivent dans l'est de la ville devraient être plus inquiets que les autres quartiers de la ville d'Ottawa? D'être plus exposés aux risques? La raison pour laquelle l'information ne nous aide pas très bien à évaluer les risques dans les quartiers, c'est que le dépistage n'était disponible que sur une base prioritaire, c'est-à-dire pour les travailleurs de la santé, les travailleurs essentiels. Et les risques d'exposition,
more to do with their workplace, not their neighborhood. Now that we've moved to be able to open testing up to anybody who has symptoms, and of course we're recommending that people with symptoms present for testing as soon as possible. You'll be prioritized over people who do not have symptoms. This will give us better data into the future in terms of understanding, potentially more about whether there are neighborhoods where rates are higher, the rates of infection. The way we do our investigation when somebody comes back positive is we look to try to understand their exposure. Did it happen in a workplace? Did it happen in a home? And so this is the information that we're analyzing and using to be able to try to identify hotspots in the community, not simply the postal code where someone lives. We need to get at where the exposure happened. Now that said, sometimes there are socio-demographic factors that are associated with being at higher risk for transmission of the virus, whether someone belongs to a lower income neighborhood could be associated with higher risk, because then that reflects maybe work that is lower paid, that is higher risk. So we're looking at all of these variables, and it'll be part of how we decide where we need more access to testing.
And my follow-up is along something else you mentioned at City Council earlier today, was about maybe doing more mobile or like a pop-up model for testing. Is that something that we would see in the near future, or what?
Yes, there are currently a couple of mobile services operating for restricted populations. The Inner City Health Team runs a mobile operation for shelters and group homes and people who would have trouble getting out to an assessment center. There's another mobile service that is some nurses that are able to help people who are not able to travel to assessment centers. We're looking at other kinds of movable centers that might be more of a booth model. And so these are things that are actively being pursued. We're not talking about, a long time to wait.
Great, thanks.
Thank you very much, everyone. Merci à tous. This is all the time that we have. C'est tout le temps que nous disposons aujourd'hui. Thank you. Bye-bye.